what does it mean when you have tennis elbow, but there is no swelling? Now, tennis elbow or lateral epicondylitis, as it is also known in the medical world, is a common overuse injury that causes pain in the outer part of your elbow that can radiate into your forearm, hand, wrist, and hand and fingers. It can even go up in your arm, neck, and shoulder area. Now, while many associate tennis elbow with a visible swelling, okay, so let me back up. When we say a lateral epicondylitis, basically this is a lateral epicondyle. This particular bone here where tennis elbow originates is known as a lateral epicondyle. And whenever there is a inflammation in the body, the term itis, that is itis, is attached at the end. Now when you say epicondylitis, that means basically there's an inflammation in this part of the body. When we think of inflammation, we usually think of pain, swelling, redness, etc. Now, while we associate tennis elbow with a visible swelling, it is entirely possible to have a tennis elbow without the swelling component. Now, in this video, let's discuss more about this and uncover why swelling isn't always a defining factor for tennis elbow. Now, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs to manage their spinal, that is back and neck, joint, and nerve pain. And I do this. That is despite low energy levels and brain fog, and that is lack of focus. Now I do this by giving you simple exercises, some easy lifestyle modification, then some tips and tricks that have helped me in my own joint, spine and nerve pain journey, and my adrenal fatigue journey. Now adrenal fatigue is a very huge, large term. It has many symptoms. However, the ones that I suffered from were low energy levels and brain fog, and anybody who has these knows how difficult it is to manage these two symptoms, plus to manage your pain or prevent your pain, whether that is spinal, joint, or nerve pain, when you have low energy levels and brain fog. So I do all of this without taking away a big chunk of your time because, hey, we are moms, we are busy people, right? So let's get into the topic for today, which is tennis elbow without swelling. What does it mean? And this is a guide for busy executive moms, or really anybody who has tennis elbow, does not have swelling, and is wondering what's going on here. Now, tennis elbow occurs when you have repetitive stress. It leads to inflammation in the tendons, as I said, that attach to this outer part of the elbow, that is the lateral epicondyle. So, if this is the point of your elbow and you keep your index finger here on the point of the elbow and the thumb and the middle finger on the sides, so this portion or this part of the bone here is known as a lateral epicondyle. As I said earlier, this is where the inflammation starts. This is also where these extensor muscles, or this group of muscles here on the darker, this is lighter side and this is the darker side. So on the darker side of your forearm, these muscles are known as the extensor muscles. They basically do extension of the wrist and fingers. So these, if you can see here, these muscles, they come here and they split into these tendons. If you can see these ropey tendons here, and then they go attach into the fingers, into the joints of the fingers. So basically those extensor tendon muscle is going from this epicondyle down into your fingers. So when there is an inflammation in that lateral epicondyle or the outer elbow, that will have an effect on the movements of your that involve your forearm, wrist, and finger or hands. So as I said, yes, the pain can also go up into your shoulder and your neck area. Now, swelling is one of the classic signs of inflammation, but its absence does not rule out a tennis elbow in this case, because let me explain this further. Suppose you consider the body's healing response. Your body has this natural healing mechanism. Your body is very smart, more smart than we give it credit for, really. So it has this natural healing mechanism that may limit that swelling. Maybe the condition is quite mild, or maybe your body has sort of gotten used to or adapted to those repetitive aggravating activities. Maybe your body has, or you have been working on reducing the inflammation in the area. You've been taking some anti-inflammatory medications, or if you're like me, I take an anti-inflammatory juice that has helped me It's a part of an 11-day free program. If you're interested, I can let you know what it is. So that helps me to manage my inflammation in my body. So maybe you're doing something like that. Maybe you're resting, you're applying cold packs, anti-inflammatory gels, something that has made you reduce the inflammation and the swelling has gone away or it has subsided, even if the underlying condition, that is your tennis elbow, is still persistent. Now, sometimes when we have long-standing chronic cases of tennis elbow, it can often involve uh, less of that acute inflammation and more of those micro tears in the tendons. I'm not saying that you will not have inflammation with the micro tears, but maybe you don't have that, in your face acute inflammation. Like when it hits you the very first time, I know that feeling, that was terrible when it hits you the first time and you don't know what's happened, but there's more damage in the area. There's more tightnesses in your forearm and you've got more restriction in your muscles and tendons. So your symptoms are more on those sides rather than the acute inflammation, really. So inflammation is there, it is going on in the background, but it is not so much that you find that that swelling is your main first symptom, right? Now, if you even if you don't have swelling, you may be wondering, now, how do I know if I have tennis elbow? So if you have pain on doing a certain movements, for example, if you extend your arm fully, and so if you extend your arm fully and you flex your wrist downwards, if this movement of extending your elbow, so straightening out your elbow, and then you can see me here, so and then putting your wrist down like this, especially with a closed fist, if you're doing this movement and you feel that pain or that tingle of pain coming up into your forearms, or especially on that outer elbow, yes, that is indicative of tennis elbow. I'm not telling you to self-diagnose, but these are just some simple tests you can do at home. And of course, then you are in a better state to decide what's happening. And if you have, say, pain on resistance, say with your arm straight, you make a fist and you try to lift your wrist upwards. However, while you're lifting your wrist upwards, maybe with the other hand, you're trying to resist it. Of course, if there's pain, please do stop. Do not keep pushing into the pain. But this is also something that would indicate that you have tennis elbow. Now, of course, if you suspect tennis elbow, you want to focus on activities that reduce stresses on the tendons, take frequent breaks from repetitive activities, incorporate gentle stretching exercises, use a hot pack, cold pack, a brace, anything that works for you. Now, one very important and often overlooked factor in managing your tennis elbow is your desk ergonomics, or how you set up your desk around you or your workspace around you. Yes, it does matter. It's not just your posture and neck pain and back pain, but it makes a difference to your tennis elbow also. So I have, there's just too many of them to discuss here. So I have put these desk ergonomics, or how to set up your workspace to manage or prevent that tennis elbow pain. I've put these into a checklist, and it is a free checklist that I will put into a blog that I have written on the same topic about tennis elbow without swelling. I will leave a link in the description of this video. If you're watching me on Instagram, you can find the link to that blog in my bio. If you do not find it, you're looking for the checklist, just send me the words, just message me the words desk ergonomic tennis elbow, and I will send that free checklist to you. Now, it's got tips on simple adjustments to your workspace that can help you relieve and even prevent tennis elbow symptoms. Now, of course, if you want to know more about tennis elbow, you can always go to my YouTube channel. I've done a lot of videos there. Or you can type my name, Swati Prakash Tennis Elbow, and those videos will come up on YouTube for you. I also have a short course that I have made on tennis elbow, which goes into the nitty gritties of what is tennis elbow, how is it caused, and of course, how to manage it in the short term, how to manage it in the long run, like how can you maintain that relatively or that pain-free state once you achieve that healing, and how to prevent recurrence of tennis elbow, which is a big topic in itself. So we have done a video on that previously as well. So anyway, I will leave a link to that tennis elbow course in that blog itself. So you will find it all in the description of this, in the description box below this video. Alrighty, so in that blog, I also talk about a lot of other things. So there's a lot of information in there. So do check it out. That's all I have for you today. If you have any questions, any comments for me, I'm happy to address them, whether it's related to this particular video or anything else that you think you might have questions on when it comes to spinal, that is back and neck, and of course your tennis elbow, nerve pain as well. So do drop them below if there are any topics that you want me to talk about, and I do know about them. I'll be happy to do that. So drop those ideas down below in the comments as well. Alrighty, I'll see you guys next time. Bye for now.